The Vibe at Vibe is sponsored video content brought to you by MedCity News.
Hello, I am Arundhati Parmar, Editor-in-Chief of MedCity News, and I have with me here today Harsh Singh, General Manager of Healthcare for Genzion. So Harsh, what are your goals for 2025?
Yeah, thanks for the question. I think let me give you a little bit of context of Genzion as a company. We started about 12 years ago, essentially focused on solving the administrative overhead problem in healthcare. Last 2 years, we have spent a lot of energy in addressing what I would refer as the clinical operations problem in healthcare. And I think we have focused into, I would say, 3 categories of problems. One is we are starting to address where physicians and clinical burnout is a challenge. So we have built solutions for physicians, for nurses, but we are also addressing a privacy and compliance problem in healthcare as well. So that's an area of focus for us to grow this year. We are focused in AI and automation in essentially solving the clinical operation challenges. And we built role-based co-pilots. We have built essentially capabilities of solution kits, working with our strong partners like UiPath and Microsoft.
Harsh, how can payers and providers benefit from the solutions you're building in AI and automation?
Yeah, that's a great question. I think we have about 70 plus clients, and we've been talking to the clients and saying what are the problems they're facing. I think one of the topics of discussion has been how to categorize the problem space, right? I think one of the things we have seen is there are specific role-based challenges. Clinical burnout, like we mentioned and we discussed earlier, you will see physicians and nurses facing a significant challenge of doing admin overhead work. And we are building role-based solutions for physicians and nurses by building healthcare agents and co-pilots. The other area we are focused on is in the functional space. Things like utilization management. We are focused on privacy and compliance. We are also focused on capabilities around patient access and denial management. So that's the second area we are helping and building solutions for. And the third area is what we call horizontal use cases. That's the HR, the finance, the developer productivity. We feel the AI and automation solutions can help organizations, both payers and providers, in that space as well.
Harsh, can you describe the health intelligence platform that Genzion has built?
Absolutely. I think our journey started about 2.5, 3 years ago as I joined the organization. Our focus on clinical operations, as I mentioned, started again a couple of years back as the technology between data, AI, and the intersection with clinical operations became real. The technologies caught up. We built a platform to be able to leverage AI to be able to solve clinical operation challenges like prior auth and specifically addressing nurses' challenges around productivity. We spent time with the clinical team, essentially realized that they had 6 challenges associated with doing medical review: extracting the right data, categorizing the documents, being able to leverage decision support and rules so that they can address the question if you need a back brace for a prior auth, is there evidence of back pain? And we are able to use our platform to be able to improve the productivity of nurses to be able to answer that question and augment their ability to do that in a much faster fashion.